Hey everybody, Nick Licamelli here, back at you with another episode of Technique Peak. Today we're talking about lumbar traction. Not just any kind of lumbar traction that the patient can take home. And that is the name of the game. We don't want our patients to be dependent on us. We want to empower them to be able to help themselves, right? We want to just guide them along the process, but we want to show them that they have the power to help themselves. So if lumbar traction works in the clinic, this is a great way to take it home. Remember that lumbar traction isn't going to solve the problem, right? We don't want to give that message to the patients, right? It's just a way to decrease some pain and tone to allow us to progressively strengthen through graded exposure for the long term. And take traction for what it is. We know through research that we're not actually gapping the spine, right? Our spines are much more resilient than that, and thank goodness that they are. The ligaments and muscles around our spine won't let us gap each joint of the spine just by pulling on our patients. But what I like lumbar traction for is that it puts the patient in a comfortable position, allows them to relax, take some deep breaths, and hopefully decrease some tone around the area. And again, that will help us strengthen progressively without pain. So give this one a shot. I think you're going to like it. Let's take a look. So we're going to get into this position here using a treatment table, and we're going to basically unweight the lower half of our bodies and kind of let that lower back get that nice traction there, nice and relaxed, all while we are cueing deep breathing. And with each exhale, we want the patient to imagine kind of melting down into the table and into the floor. This position allows the patient to self-select the amount of traction that they want to feel, right? The intensity of the pull. So if they don't feel comfortable, if they're apprehensive, if there's muscle guarding, if there's pain, the patient can kind of self-direct the amount of traction that they're applying to themselves by controlling the weight that is put into the feet. So the less weight that they put into their feet, the more pull they will feel on their spines. Thank you so much for watching this episode of Technique Peak, and we'll see you next time.